Hi, everyone. Welcome to another episode of Health Talk with Riva. I am your host, Riva. I'm a medical doctor and a researcher, and I'm joined today by my co host.
And I am Tech World Travels and Review, here to discuss a really interesting, maybe controversial disease. So I'm looking forward to having this discussion. Well, let's get started.
Yeah, our podcast is all about talking about things that have been trending in the news with regards to our healthcare. And so, one topic that has been in the news for over a year now has been this measles outbreak that's currently going on globally. And so, today we just wanted to share our discussion with you. Again, this podcast is intended for information purposes only. If you're feeling unwell or you need medical care, please consult your healthcare providers.
Right. So, jumping ahead here, we hear about measles all the time in the news. It's like one of those diseases that we never seem to get a handle on. So just to make sure everyone is on equal playing field in terms of education, my first question is, what is measles?
Yeah, so measles is a highly infectious or contagious serious illness that is caused by a virus. And this has actually been something that has first been described in the 9th century, and it existed much longer than that. It was responsible for millions and millions of deaths prior to 1963 when the first measles vaccine was discovered.
And like many other viruses, they always seem to come from an animal host. Does measles have an animal host?
There is some documented history about that, but the current measles outbreak does not have an animal reservoir or host. This is something that's transmitted from person to person.
Interesting. So now, thinking about measles, what are some of the symptoms that people will show if they have measles?
Yeah, if you were exposed to someone that has measles, the first thing that would happen is like an incubation period where you feel completely fine. You might not have any symptoms for a few weeks. This can last up to about 3 weeks. After that, there is the prodromal phase. In this phase, you usually have very symptoms that are very mimicking of a flu or a cold. So the first thing that happens is a fever, and this is a high-grade fever, so a fever that is more than 38 degrees Celsius or more than 101 degrees Fahrenheit. And then there's these 3 C's that doctors talk about that are very classical with measles, which are coughing, something called coryza, which is really sneezing or runny nose. And then the third thing is conjunctivitis, which is another way of saying that the eyes are inflamed, they're red, they're itchy and watery. So after that prodromal phase, that's when a very characteristic rash will appear. So this rash is kind of a flat red rash that has like a bump on the center of it, and it would usually appear around the hairline, so behind the ears, on the back of the neck, and mostly around the hairline. This rash actually starts on the head and then kind of just goes downwards the body. So it goes to the face, the neck, the abdomen, thorax, and then to the arms and legs. This rash actually kind of comes together and kind of clusters together and forms like this little blotch of red spots. So we're going to show you some images of what this looks like. And so this rash is very characteristic of measles. This rash can then begin to go away and the symptoms can start to alleviate. And that is like the final phase of the infection, which can take 2 or 3 weeks. And so these rashes will all start to dissipate or fade away at the same time. There's also one more thing that parents can also look for if they're not sure if these rashes might be measles, and that is there are some spots that can appear in the mouth, and these are white spots that can appear in the cheeks and on the back of the mouth, and they're also very characteristics of measles.
It's so interesting that the rashes they start from your hairline and move downwards. Is there
Yeah.
a reason like why that happens that way?
No, that is really just what makes the measles rash very specific. It's very different from, for instance, like chickenpox rashes, which the chickenpox rashes starts on the chest or the abdomen and kind of moves outwards to the arms and limbs and face. And the chickenpox rashes look more like blebs, so they're water-filled boils or pustules, or we call them vesicles in healthcare. So those ones are very different and they're very itchy. And the difference with the chickenpox rash and measles is that the chickenpox rash can have different phases, which means, like, for instance, if they start on the chest, they might start disappearing on the chest. They might scab over. And while those ones are scabbing over, the ones on your hands or face can still be those red blistery bumps.
And the blisters is like when you're wearing a shoes that's not the right size, you get these blisters on your like feet. It's a similar blister you see with chickenpox, right?
Yes, so it's a water-filled blister. Yeah.
Interesting. So good to know those different types of rashes when it comes to determining if it's chickenpox or measles. My other question here is, what are some of the serious complications with measles?
Yeah, so for folks that are unvaccinated or immune compromised or kids, pregnant ladies, measles can become very serious. For kids, it's very common for them to develop something called like a middle ear infection, which can be very painful and would require sometimes antibiotics or further treatment. And then other complications can be pneumonia, in which case, if the pneumonia becomes more severe, you might notice someone having difficulty breathing, coughing excessively, and in those cases, sometimes hospitalization and further treatment might be required. There's also encephalitis, which is when that measles virus goes into the brain and can cause inflammation, which can be very serious and can definitely require hospitalization. And then there is a very long-term complication that could happen like 5 to 10 years even after someone has experienced the measles, which is something called SSPE, which is a panencephalitis. And that can be very serious and can cause a lot of serious complications for someone. But again, this is something very rare and it happens, for very further away in the future for someone that had an outbreak.
Yeah, that's the question I was going to ask, is that I know a lot of these viruses, they never get completely eradicated from your system. Some of them stay in your system, like herpes, for dormant for many, many years, and then it shows up when your immune is like low. Is measles one of those viruses that can show up later on when your immune system is sort of like at the lowest point?
Yeah, usually if you clear out the measles, so when you start feeling better, you start eliminating that virus, it tends not to reoccur. But the thing that makes measles very serious sometimes is the fact that it causes something called an immune amnesia, which means that it destroys a lot of the immune memory cells. And when this happens, all of the memory cells that usually fight off infections that we were exposed to in the past, they get damaged. So for instance, if as a child you had chickenpox before, usually they say like your body has immunity to chickenpox, so you tend not to have that again. However, if you've had measles, it can destroy those memory cells that would recognize the chickenpox virus and fight it off, which means you can have chickenpox again. You can have a sore throat again. So the thing about it is it takes years for your body to build up an immune library again. So that is one of the serious things about measles, and it does cause long-term effects in that case.
So measles is kind of like those vicious disease where it not only infects you, it also destroys your immune memory, so that you actually become more compromised for disease that you probably had immunity in the past. But that's also one other question I want to ask is, with measles, once you get measles and let's say you get cure of measles, do you have like immunity for life?
Yeah, the immunity is actually long term, so it's much longer than some other infections. So, yeah, some people can have immunity for life.
Interesting. And then kind of jumping into like prevention. How do you prevent against measles outbreak and measles in general?
Yeah, so the best prevention still is vaccination. And vaccination
Is
usually,
there like a special type of vaccination you need?
yes, so you need the MMR vaccination. So this is the common vaccine that
What's MMR?
measles, mumps, and rubella.
Oh,
Yeah,
okay. Measles,
so
mumps, and rubella, and those are like the same viruses.
they're very similar
So
viruses
one vaccine.
that covers three different infections.
Interesting. Okay.
And so these are usually given to kids, but over time, other people can get these vaccines. So it doesn't mean that if you're an adult, you can't get this vaccine. That is something you can get as an adult as well. Also, to note, if you are severely immune compromised, let's say you're getting, chemotherapy for cancer, or you have an autoimmune disease, you're someone living with HIV and your immune system is currently compromised, there is a other treatment that can be used to prevent a measles, especially during this current outbreak. So we do have some immunoglobulins that can be used as a post-exposure prophylaxis. So if you were in contact with someone with measles, given that, one person that has measles can transmit it to 12 to 18 people within their circle, then, it might be a treatment that is necessary for someone who is immune compromised.
So interesting. So, questions on getting vaccinated for measles. Is that vaccine, when you get vaccinated, does that immunity that you get from the vaccine wane over time, or is it permanent, like the
It's
natural
usually,
immunity?
yeah, it's usually permanent, especially with the current modern vaccines. You might have to get multiple doses to get that full immunity, but that immunity is actually quite
Oh,
good.
so you'll have to, like, if you get vaccine as a child for MMR, there's a possibility you might have to get another vaccine later on in an adult.
Some people do. So sometimes, doctors will do something called a titer count, where they look to see if your body has has the immune cells to recognize the infection and fight it. So in some cases, you might recommend another shot, especially because, as we grow and as time moves on, vaccines also develop and get better. So it could also be that the vaccine that we had as kids, depending on where we were born and where we grew up, might not be able to protect us as we get older.
So on the whole like vaccination topic here, what if I have a vaccination for measles or MMR vaccination, and I come in contact with someone that doesn't have measles vaccination, but might have measles? Can they, like being in contact with them, can that also like compromise me and I become infected?
No, usually with the current outbreak that's happening, especially in North America, we've seen that mostly this is in folks that have never been vaccinated, not even one dose.
So then let's lead into what's on the news. So why is measles constantly on the news right now and never seems to like miss the spotlight?
Yeah, so measles, there have been many outbreaks over history with measles, and we currently have another outbreak going on globally. There's more than 2,000 cases here in in the US, and in North America, we are still struggling to prevent this measles outbreak. The thing about this current outbreak is we've noticed it's mostly affecting young kids, folks that have compromised immune systems, older folks that are being treated for cancers, autoimmune disease, or people living with HIV. Those folks are more at risk. Pregnant ladies are especially at risk, and children. So children that have never been vaccinated also are very much at risk. So with the current outbreak, the problem is in North America, we had what we call elimination status. That means we did not have enough cases of measles every year that would change the way that this is the exposure levels. So the current outbreak has been so bad that certain countries have already lost their elimination status. The US and Mexico are currently at risk of losing that status, which means that we can have an even wider outbreak that we are not able to control. So that is what's currently going on. That's why people are still talking about measles a lot, even though this is something we've heard about, from time to time in the news. This seems to be one of the really big outbreaks.
When you say outbreak, does it mean that it's a new variation of the measles, or is just that it's a hotspot where more concentrated set of people have measles?
Yeah, I think it's just more concentrated people right now.
Interesting. And I think me and you were chatting offline that there are certain countries that, because of the outbreak, they're at risk of losing eradication status, and some countries are like completely eradicated of measles. Can you touch on that?
Yeah, so for instance, right now, I know Canada has lost its elimination status for measles because the number of cases that it has is so much that it no longer has that status anymore. The US and Mexico are currently at risk of losing ours based on the number of cases and the widespread area or geographics now that this is covering. Also, even in the UK, they've lost their status as well. So it's quite interesting how this has been going on globally. I know there's a lot of travel advisories for certain countries. I know Argentina is also a country in South America that also lost their immune status. So this is something that's going on globally, and that's why we're talking about it so much, to bring some more information out there to people, so that if you are someone might need some more information about it, that this starts that conversation.
So interesting that you mentioned that. What does it mean? And Canada, you need to do better. Knowing that I'm from Canada, what does it mean to lose your eradication status for measles?
Yes. So, okay. So Canada has lost its elimination status. So elimination status means that there is no continuous transmission of the measles or any virus for about 12 months. So, of course, we have gone to the point where Canada is now an endemic country for measles because we currently continuously have spread of measles. So eradication now this is a different word, means that it no longer naturally exists within the world. So to be clear, countries are at risk of losing their elimination status, meaning that there continues to be spreads, which means they are now endemic. Meanwhile, eradication would be if it was globally, if we were able to completely eliminate this in all countries in the entire world.
So it basically means for the last 12 months, there's a continuous spread of measles in Canada.
Yeah.
And that is why it's an endemic.
Yeah, not just Canada, like the UK as well, and other countries as well.
Okay, well, interesting to know that the US still holds its title for not being a eradication country
For now. Yeah.
Cool. Well, that wraps up all my questions around measles. Hopefully, this was helpful to everyone. Any last words around measles that you want to share with the audience?
Yeah. My final thoughts are, one thing I wanted to mention is yes, there is no cure for measles. There are treatments that we can use that are just really supportive therapy. I just want to caution parents out there to, avoid giving your kids Advil or ibuprofen if they do have a fever of over 38 degrees. Tylenol is the better option for those types of fever. And if the rash is accompanied by diarrhea or other symptoms, it would be the best option to seek care, even if you are an adult that is suffering with these symptoms.
Awesome. Well, good discussion here today. And we hope you guys can leave some comments below if you have any questions about measles or even anything in healthcare. I know you've got some comments about different symptoms that people experience or whatever. We can answer those in the comment below. Make sure you like and share the podcast.
Thanks, everyone. See you on the next podcast.